Thank you. Yeah, so this basically covers some work we did pre-pandemic now on Flying Start in Wales. So it's the equivalent of the Sure Start in England. So very briefly, going to look at what Flying Start is, um, what the aims of the project was to work with the Flying Start data, the methodologies, findings, and briefly some next steps. So broadly speaking, then Flying Start essays is the equivalent of Sure Start in England. So four key elements of the programme are high quality childcare for 2-year-olds, enhanced health visiting service from health visitors, access to parenting courses, and additional support for speech, language and communication for the children under the programme. It's a targeted program. I shouldn't say targeted, but it is prioritised in areas of disadvantaged in Wales. So it's allocated, the funding is allocated based upon the Welsh Index of Multiple Deprivation. The program's been running since 2006-7, and I think it's been seen various phases of expansion, I think in 2013-14, and the aim of it is to improve life chances, so to, as they give children that flying start in life. Just briefly look at the logic model, probably best look at it in more detail here. The four strands basically, so it covers health, childcare, speech and language development, and parenting. So the outcomes are expected, listed here basically. And I think the multi-strand approach, is one which, it has a sort of cross-cutting analysis, cross-cutting nature of it, in order to give children the support they really need in different areas. So the two key planks are the childcare element and the health visitor element. So what we're going to do today is look at some of the results of some analysis we did using data from Swansea. So basically, previous evaluations of Flying Start looked at an area-based analysis, and this was the first time we aimed to use individual level data for Flying Start to look at outcomes for health and education and social care. And then there's an element of this where we were looking at different levels of engagement with Flying Start. So using individual level data, we can look at how much Flying Start they had. So this whole area around dosage. And the aim of our analysis was to feed into future policy making for Flying Start in Wales. So basically, yeah, we were looking to collect data from all across Wales, but in the event we had just data for one authority. There's still an ongoing project to obtain more Flying Start data for different authorities, but Swansea were being co-located with the Sale data bank. They were nearest, as it were, to provide that we could work more closely in partnership with them to get their data into the Sale data bank, and they're very supportive of what we were trying to do. And as the project went along, we worked closely with them to sort of QA the results and various things. But they provide us with data covering quite a long series of data, and they kept submitting more data to the data bank as they went along. So we had a group of around 8,000, so a cohort over that period. And what we did, we used that as the sort of like the cases, and then as a control group, we actually used the other children living in the Swansea area. So we subtracted the Flying Start children out of that, as it were, and then left the rest of the children in Swansea in a non-Flying Start group. And basically what we did, for both these groups, we linked the data from the Flying Start programme to outcomes in terms of health and education. We looked at A&E attendance, we looked at hospitalisations, and we looked at school attendance. And then having done an initial analysis using for those areas, we went on to look at outcomes for when children start in Key Stage 1 at school, not Key Stage 1, but what we call the foundation phase in Wales now is Key Stage 1. Sorry, I get confusing. But we could look at, so part of it was around school readiness, getting children in Flying Start areas more ready for school, so that when they do go into school setting, they can learn and develop more quickly. So we were did some analysis looking at using the initial assessments that are carried out on children in the first 6 weeks or 6 or 8 weeks of their entry into sort of nursery education. So basically, we linked Flying Start data with birth records, hostel records, and education records, and this provides a sort of cross-cutting nature of the analysis. So you could look at the same group of children across the various different spheres. So basically, we drilled down from down to various levels. So from what we have in Wales is that the WDS Welsh Demographic Service population spine, as it were, which comes from the NHS Central Register, and from that we can identify the Flying Start children and then the non-Flying Start group. And then as the analysis progressed, we thought, well, we'll drill down deeper. So to look at the dosage effect, we started to look at childcare. So we had a group of 8,000 in the health visitor group, and then we had a smaller group who we had records for childcare data records for. And so from scratching the surface at the top and providing initial indicator, we went on to look at things at a more detailed level as time went along. So some early statistics we had were around birth statistics and headline indicators. So we was able to look at low birth weight for Flying Start and non-Flying Start, and you can see there how as the program develops, you can see there was an impact on low birth weight, and for births of teenage mothers also reduced over time. So you can see there the relative impact that Flying Start had compared to children in non-Flying Start areas and for Wales. So that was a good first stab at some indicators in analysis for this project. And then we went on to look at hostel admissions for 0 to 4-year-olds, and you can see here that there was a gap between the Flying Start and non-Flying Start areas, which we were able to sort of have an impact on, and a possible protective effect of Flying Start on hostel admissions. And then we looked at school absence, and you can see here that in terms of school absence, there was here you see that actually the impact of both Flying Start and the change in regulations as regards children being taken out of school during term time. And you can see here that there's actually we actually managed to close the gap a bit. The impact on unauthorized absence was perhaps bigger than the new regulations compared to non-Flying Start areas, but you can see there that hopefully that improved outcomes for Flying Start children. And then, as I say, we looked at dosage. We looked at 6 different ways to measure the amount of childcare. So we were looking at both health visitor contact and childcare, and we looked at 6 different ways to categorize the amount of childcare that children received. And basically we consulted internally and with stakeholders and came up with something which looks like this. The 156 sessions is based upon 39 weeks and 4 days per week, 4 sessions per week. And then we also looked at using because we had the number of sessions they agreed to, a number of sessions they attended. So we looked at also percentage attendance, and you can see here this gives a sort of fairly even split between the 4 groups that generates. And so as we went on, we drilled down deeper into the data and looked at outcomes based upon childcare. And you can see here that there's a different impact. There you can see the different levels of A&E attendances for those who had lower percentage attendance in childcare. And then we also looked at hospital admissions for the same groups, and you can see here that as time goes on, you can see a difference between the different groups. Sorry, there's so much data here. I've forgotten what's what basically. But overall, what we discovered was that the percentage attendance had a bigger impact on outcomes than the actual number of sessions agreed to. So you can see here for absence from school, unauthorized absence and overall absence, that where attendance in childcare was higher, the children tended to have lower absence at school in due course. So that suggests it's more to do with having been in the routine of going to childcare rather than the actual amount. So in terms of dosage, I think that has a bigger impact rather than actual number of sessions agreed to. And then if we break down, looking at outcomes, I have to skip over this one. So looking at outcomes in terms of school readiness when children go into school, you can see here that where attendance was higher, the outcomes tended to be better. So overall, in terms of dosage, it does appear that the actual percentage of attendance has a bigger impact than the actual number of sessions agreed to, rather than the number of days per week. And then we also looked at outcomes by area of learning on entry assessments, and you can see here. I didn't actually produce this myself in the release, so again, you can see the impact that the percentage attendance has on outcomes. So the results I presented here were released in 3 releases in 2019. The links are available there. We did these as brief sort of snapshot sort of releases rather than do a full journal articles, because we was aware as the project had gone on a while, we needed to get something out fairly quickly. So we did these as releases on the Welsh Government website. And then possible next steps. There's still a number of different research questions we can look at relating to Flying Start in Wales into Swansea. One element we've not looked at is the amount of health visitors impact in contact children have had with the programme, and we need to sort of go back and look again at the logic model and whether that has achieved the outcomes. And we're also open to receive data from further local authorities and develop the analysis further. So what we do was very much proof of concept, but there is an outstanding aim that if we can develop it to look at the whole of Wales when we would in due course if we were able to. I hope that was useful. Apologies for being a little bit unclear on the results there. There was we did do a lot of analysis in a short space of time, but we believe that what we did had an impact in terms of building the evidence base of Flying Start in Wales. Thank you.